Hello, everyone, and welcome back to the Wisdom English podcast. I am Sarah.
And I am Brian. Welcome to episode 193.
Oh dear, Brian, you sound terrible. Are you okay?
Not really, Sarah. I have a splitting headache, a runny nose, and I think I'm dying.
You aren't dying, Brian. You just have a man flu.
It is not man flu. It is a serious medical condition. I need drugs. I need medicine.
Well, you are in the right place. Today, we are talking about going to the pharmacy.
Yes, we will teach you how to describe your symptoms, how to ask for the right medicine, and how to read those confusing labels.
Because when you are sick in a foreign country, you need the right words to get better fast. Let's go get Brian some help.
Sarah, if I am sick in New York, I go to the pharmacy or the drugstore.
But if you are in London, you go to the chemist. I'm just popping to the chemist.
A chemist? That sounds like a scientist mixing potions in a lab.
Historically, they were scientists. But yes, nowadays we also say pharmacy. Look for the green cross symbol.
In the U.S., a drugstore like CVS or Walgreens sells everything: medicine, milk, candy, makeup, even cigarettes.
Cigarettes in a pharmacy? That is very counterproductive. In the UK, a chemist mostly focuses on medicine and toiletries.
Okay, I'm at the store. Now I need to find the medicine, but not all medicine is on the shelf.
Sarah, can you just buy antibiotics off the shelf?
No. For strong medicine, you need a prescription.
A prescription, or a script, is the piece of paper or digital note from your doctor authorizing the medicine. I need to fill a prescription.
You give it to the pharmacist and they prepare it for you. This is called filling the prescription.
Contrast, but for your headache, Brian, you don't need a doctor. You need OTC medicine.
OTC stands for over-the-counter. This is medicine you can buy without a doctor's note, like aspirin or ibuprofen.
You can find these in the aisle. Excuse me, which aisle is the cold medicine in?
But before you buy it, you have to talk to the pharmacist. You have to tell them what is wrong. You have to describe your symptoms.
Brian, saying I hurt is not specific enough. How does your head feel?
It is a splitting headache. It feels like my head is going to split open.
We often use the word ache for a continuous dull pain. Headache, stomachache, backache, toothache.
But if the pain is sudden and sharp, we call it sharp pain. I have a sharp pain in my chest.
Or a dull ache. That means it is not strong, but it is always there.
What about my nose? It is running like a river.
You have a runny nose. Or if you can't breathe through your nose, you have a blocked nose or stuffy nose in the US.
And my throat hurts when I talk.
You have a sore throat. Sore means painful and red. I have sore muscles. I have a sore throat.
And I feel hot and cold at the same time.
You might have a fever or a temperature. I think I'm running a fever.
So runny nose, sore throat, splitting headache, fever.
Congratulations, Brian. You have the flu, influenza, or maybe just a bad cold.
Great. So what can I take? Let's talk about the different types of medicine.
Brian, do you prefer to swallow pills or drink liquid?
I hate the taste of liquid medicine. It tastes like cherry-flavored poison. I prefer pills.
We have different names for solid medicine. Tablets are usually round and hard. Capsules are oval and plastic-looking, often with powder inside.
For your sore throat, Sarah, you should take a lozenge.
A lozenge, or a cough drop, is like a sweet that you suck on to soothe your throat. You don't swallow it.
If you have a cough, you take cough syrup. That is the liquid stuff.
If you have a skin problem, like a rash or a bite, you need an ointment or cream. Apply this ointment twice a day.
And if you have dry eyes, you need eye drops.
And for pain, we call them painkillers. Can you recommend a good painkiller?
In the US, we use brand names a lot. Do you have Tylenol? Do you have Advil? In the UK, you use the generic name, paracetamol or ibuprofen.
Be careful, Brian. Paracetamol and Tylenol are the same thing. Don't take both. That leads us to the most important part, instructions and warnings.
Brian, I bought these pills. Can I take 10 of them right now to feel better faster?
No, Brian, that is an overdose. You must check the dosage.
Dosage is how much you should take. The label usually says, take 2 tablets every 4 hours.
Or do not exceed 8 tablets in 24 hours. Exceed means to go over.
Some medicines say take with food or take on an empty stomach. This is important for your digestion.
And you must check the side effects.
Side effects are the unwanted things the medicine does to you. The most common one is drowsiness.
Drowsiness means feeling sleepy. The label will say, may cause drowsiness. Do not drive or operate heavy machinery.
Heavy machinery, like a tractor? I don't own a tractor.
It means a car, Brian. Don't drive your car if the medicine makes you sleepy.
Another side effect is nausea. That means feeling like you want to vomit.
Or dizziness, feeling like the room is spinning.
If you are allergic to anything, tell the pharmacist. I am allergic to penicillin.
Okay, we have the vocabulary. Now let's act it out. Let's go to the pharmacy counter.
Hello, how can I help you today?
Hi, I was wondering if you could help me. I'm not feeling very well.
I'm sorry to hear that. What seem to be the symptoms?
Well, I have a really bad sore throat and a bit of a cough. It's keeping me awake at night.
Do you have a fever?
No fever, just the throat and the cough.
Okay. Are you currently taking any other medication?
No, nothing.
Do you have any allergies?
I'm allergic to aspirin.
Okay, good to know. I recommend this cough syrup. It is specifically for dry coughs, and these lozenges will help soothe your throat.
Great. How should I take them?
Take 10 milliliters of the syrup before bed. It might make you a little drowsy, which will help you sleep. And take a lozenge whenever your throat hurts, but no more than 1 every 2 hours.
Understood. And can I buy some painkillers too, just in case?
Yes, you can take paracetamol with this, but avoid ibuprofen since it can irritate the stomach.
Perfect. How much is that altogether?
That will be $15.50. That was a perfect consultation.
Brian, we have covered headaches and colds, but what about the embarrassing problems? The ones you don't want to shout about in a crowded shop?
Oh, you mean bathroom problems? Tummy troubles?
Exactly. When you travel and eat strange food, your stomach often suffers. You need to know the polite words versus the slang.
Okay. The medical word for a loose stomach is diarrhea, but that is a hard word to spell.
It is. In the UK, if you want to be polite, you might say, I have an upset stomach, or slightly more graphic, I have a stomach bug.
In the US, we have some funny slang. We call it the runs. I have the runs because you have to run to the bathroom.
Only use that with friends, Brian, not with the pharmacist. The opposite problem is being constipated.
Constipation is when you cannot go to the bathroom. You need a laxative.
And what if you ate too much spicy food and your chest feels like it is burning?
That is heartburn or acid reflux. You need an antacid.
In the UK, a very common word for general stomach pain after eating is indigestion. Do you have anything for indigestion?
Okay, enough about toilets. Let's talk about the air. Springtime is beautiful, but for me, it is a nightmare.
Ah, you have hay fever.
Hay fever is an allergy to pollen from flowers and grass. My eyes get itchy and watery.
You need antihistamines. These stop the allergic reaction.
What if I get bitten by a mosquito and my skin turns red?
That is a rash or a bite. You need hydrocortisone cream or just anti-itch cream.
By the way, Sarah, sometimes the pharmacist gives you life advice, not just drugs.
Yes, they often say, keep your fluids up. This means drink lots of water.
Or get plenty of rest. Or, my favorite, let it run its course.
Let it run its course means don't take medicine. Just wait and the body will heal itself.
I hate that advice. I want a magic pill to fix me instantly.
Be patient, Brian. Medicine isn't magic.
Okay, I think we have truly covered every part of the body now, from the splitting headache down to the upset stomach.
We certainly have. Now, let's wrap this up before we catch any more imaginary diseases.
I feel better already, just knowing what to say.
So, today we learned the difference between the chemist and the drugstore.
We learned symptoms like splitting headache, runny nose, and dull ache.
We talked about forms of medicine, tablets, capsules, ointment, and lozenges.
We learned to watch out for drowsiness and side effects.
My advice, if you travel, take a photo of your medicine labels. It helps the foreign pharmacist find a match for you.
Listeners, we hope you stay healthy, but if you do get sick, now you are prepared. Question of the day. What is your go-to home remedy when you have a cold?
Do you drink ginger tea? Do you eat chicken soup? Or do you just sleep for 3 days? Tell us in the comments.
Stay healthy, wash your hands, and see you next time.
Goodbye.